showing a good level of interest, not only in India but outside India, of course. And people are asking us, we are on promo now, we are free. So they're saying, okay, when are you coming up with packages? This looks interesting. And more so people who are, need to follow up, need to, probably need to talk to them and have follow up. They've had some queries and then they are saying, okay, let me look through it. Like, let me give an example. There was a case from New Zealand. She had probably not a very, elaborate disease, but something which required lifestyle change plus a little bit of medication. But then the doctors in New Zealand kind of probably, scared her out and, they didn't know what was going on with her. But she had 3-4 consultations with our doctors, and she did it over a period of 3 weeks and saw that there was a difference. So these kind of things are coming up. I would say the answer to your question is initially people will try it out with not so critical stuffs and then get the confidence, and in a span of time you will see a lot of consultations happening over online.
I see 2 key challenges there that I think any company in that space would have to overcome. The first one is that in a country where health insurance, which is probably the most important thing a person should have, the penetration for a product like that is 3 to 4%, right? How do you then convince that same population to buy products online, whether it be diet plannings or doctor consultations, etc., which are elective, right? I mean, one would think that health insurance per se is the most important product. So I'm pretty sure that in any service that's charging the consumer, there would be an element of of a hard sell or a strong value prop that you would need to have. Secondly, I think when you look at online businesses per se, whether it's online healthcare or online anything else, people in India, again, it's making people transact online, again, has historically been a challenge. And I think lately the few businesses online in the group buying space and the private sales space that we've seen that have managed to overcome that barrier, again, is if you give the customer a very strong value prop. The value proposition could be in 2 forms. I think one is extremely superior convenience or a big convenience factor, which you cannot otherwise have. So I think one of the panelists for this discussion was to be the CEO of Healthcare Magic, and I think that's one service that has a fantastic value proposition when it comes to convenience, that you can actually chat with a doctor or speak to a doctor from your home, office, etc. And I think the second value proposition that customers normally associate with the internet, something that the internet should deliver, is value. So people typically go on internet for deals. So I think any online healthcare business that can deliver that can ride on the internet's capability to generate scale, generate volumes with much lower distribution costs than a traditional offline model could. And I think diagnostics would be, diagnostic services, which I think that's something you're into, would be a classic case for that, because diagnostics industry per se is a high fixed cost business. So if you can generate volume through the online medium, then there is a significant discount that can be negotiated with the providers and that can be passed on to customers, thereby giving them a significant value proposition to purchase those diagnostics online. And I think at Health PA specifically, what we've done is we've also looked at other groups of payers. So we subsidize the service and indeed have a free version of the service, which is paid for or subsidized by corporations and by hospitals, to make it more saleable.
Thanks, Nitin. My question to, what do you think about yours? I mean, is it a B2C model, is it a B2B model, and what made you decide what target audience you are going for?
Okay, actually, it started off really as a B2C model. And I have to admit that after a couple of years of working on this, 2007, 2008, we realized that actually in the healthcare world it didn't really work. See, people are ready to come online for, maybe for gaming and even using the mobile for gaming. using the mobile and online for a serious uploading of health information and doing your own health management, we found that, yeah, there were people who were coming in, but the percentage wasn't as good as we would have liked. So we actually shifted our model to a B2C model. We use the same technology. The technology was the same, the PHR and the smart cards, but now actually we are giving it to the patients through the hospital, and we find much more acceptance. Actually, we have more than 1.5 lakh of patients, and all of them, most of whom have come through hospitals. And here, actually, if the doctor tells you, you take this package and I'm going to charge you 200 rupees more for it, and you take this package, you're going to get reminders to take your medicines. The patient will do it. We had the same thing online as a care package, and as long as it was free, people used it. Once, after a year, we said, okay, it's going to be charged. I mean, it's a trial and it's going to be charged. People just stopped coming. So I think to that extent, I think healthcare is still something that is very driven by your doctor and your hospital. I mean, I will do something which my doctor tells me and just do it on my own. So I think that's something that people need to look at. And the other thing is actually when we went to the B2C route, the B2B route, the other thing which hospitals said is, why should I give this to my patients? I mean, I know patients are getting an advantage. They have this smart card with emergency care information built in, and they're getting a PHR. But what am I getting? So we had to really look and see what is it that the hospitals needed, which was missing, which we could add as an application or as a further service, which actually could help this PHR and smart cards go to the consumer, which was what was the goal. I mean, our goal was really to be a patient-centric. So then we added, this record management, because we found that clinical record management in hospitals is still not very prevalent. People are using hospital management systems, but that is more for process management. I mean, there's tons of clinical data which is just lying in files, and it is not being put into, and it's not being put online, or it's not electronified, because doctors are not ready to use the system. So we had to give some system to them, which would, which wouldn't force doctors to use. So we had to, maybe make it more easy for them to use, or even give services, digitization services as part of the whole bundle. So slowly this whole electronification of records has started to happen, and it also benefits the patient, because directly now the records are going to the PHR. I don't have to physically either scan or upload or do anything. And for masses who are really not online savvy, this is a much better way for have it come from the hospitals. So that's kind of, I have to say, we did change the mission is the same, but the way we actually are going about it has changed in the last year, and we are finding more, acceptance in this.
Well, I think IT enablement, if we talk about, we'll come to you for the question. IT enablement, if we talk about how was it started in hospitals, I think the prime example for that was data. There was a lot of patient data which was only a data, not information, because it was not put into context. Nobody can upsell and cross-sell to you till the time people don't know what you're suffering from. For example, if you come down to one of the diagnostic labs for a diabetic checkup, and the hospital knows that you are a person who is suffering from diabetes, probably at that point in time I can upsell or cross-sell rather than not knowing anything about you and bombarding you with clueless information. So I think that was the first context why data was put into context and IT came into. Then efficiency, productivity, and all these things actually added up to it. So I think that was a prime good example. I also want to mention here the public-private partnerships. The PPP kind of stuff, I think when we actually stand alone as a standalone entity, probably doing something like an online health record kind of a thing, or a website which is regarding healthcare information. We all know about the .com burst today. So most of us end up, either closing the business down, or probably not scaling it up, probably not putting much investment into it, probably doing a tie-up internally and raising money. But when it comes to public-private partnership, when you get a lot of support, and I think Girish will tell us more about it, because he has been driving the National Rural Health Mission program with CARE Foundation as well. I think, look, there's a story on this. I think we heard a story before, and it's a similar story. There was a small crow who was sitting on a tree and was chirping on the uppermost branch of the tree. And there came a hen and said that, "Oh, you are singing very nice. Can I also sit at the bottom of the tree and sing like you and not do anything the all day?" So crow said, "Yeah, we are most welcome. Please do all the stuff which you want to do. Entertain yourself, enjoy, sing." And there came a fox, ate up the hen, and the hen was dead. So what is the moral of the story? The moral of the story is, to do singing and to do nothing every day, you must be sitting very, very high up. So basically we are a developing country, and here, like UK and US, things will not move there by their own. So there has to be a lot of support that should come from the government also, and we should cash on the National Rural Health Mission, Ministry of Health and Family Welfare programs, and several such things. I think I will give the opportunity to Girish to probably explain what has he done as a part of the CARE Foundation in terms of NRHM and how it actually helped. If you want to probably show a few slides also, that is perfectly fine with it.